How does Raynaud's phenomenon cause cyanosis in lupus patients? Imagine your fingers turning a strange shade of blue or purple, especially when it's cold or you're stressed. That's often what happens with Raynaud's phenomenon, a condition common in people with lupus. But how does this lead to cyanosis, or a bluish discoloration of the skin? Let's explore this step by step. Raynaud's phenomenon involves abnormal blood vessel responses. Normally, blood vessels in your fingers and toes widen to bring blood flow and warm your skin. But in Raynaud's, these small arteries constrict too much, especially during cold exposure or stress. This intense narrowing reduces blood flow significantly. When blood flow decreases, less oxygen reaches the skin and tissues. Cyanosis occurs when there is a higher level of deoxygenated hemoglobin in the blood vessels close to the skin's surface. Hemoglobin is the protein in red blood cells that carries oxygen. When oxygen levels drop because blood isn't flowing well, the blood becomes darker, and the skin may take on a bluish or purplish hue. This is especially noticeable in areas with thin skin, like fingertips, lips, or the tip of the nose. In lupus patients, Raynaud's phenomenon can be more prominent due to the autoimmune process affecting blood vessels. Lupus causes inflammation and damage to blood vessel walls, making them more prone to spasms or constriction. During a Raynaud's attack, the sudden constriction of these inflamed vessels leads to a sharp decrease in blood flow, and consequently, oxygen delivery drops. The skin then appears cyanotic because the blood contains more deoxygenated hemoglobin. It's important to note that cyanosis in lupus patients with Raynaud's is usually temporary. Once the blood vessels relax and blood flow resumes, the skin color returns to normal. However, repeated episodes can cause tissue damage if blood flow is severely restricted for extended periods. If you notice persistent or severe cyanosis, it's essential to consult a healthcare professional. They can evaluate your symptoms, check for other possible causes, and suggest appropriate management strategies. Managing Raynaud's often involves protecting your hands from cold, avoiding stress, and sometimes medications that help improve blood flow. Remember, lupus and Raynaud's phenomenon are complex conditions, and individual experiences can vary. Always seek personalized advice from your healthcare provider to ensure proper diagnosis and treatment.